Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jahangir Wellness Center. My name is Kavas Jahangir. I'm here from the JWC studio this week. I've got a very, very special guest. I've had many, many guests here throughout our Wellness Day series. But today I've got my very own doctor. I've got Dr. Divate over here, who is an absolute stalwart in the space of healthcare. She has been practicing for over 53 years now. She's been at Jahangir Hospital for 33 years. As I said, she's been my doctor for as long as I can remember. Is the head of research of two of her institutes. She's been leading clinical trials and into the future as well. And so thank you so much for being here, Doc. It's finally a pleasure to have you here personally.
Kawas, I am so delighted to be here, especially talking to you. You shoot your questions.
Oh, we're going to go straight into the questions, is it?
Okay.
We can go straight in. But first, let me tell you, I'm not, someone sent me your profile just because, we were doing these episodes and so forth. And it's the longest profile that anyone has sent me. They've got, I think, over 8 pages of your accolades in terms of the research papers that you've done. So that is incredible in terms of the work that you've done and the fact that you're such a practicing doctor. And so, how do you balance both being a practicing doctor and so head into research? Why don't we just start over there from your personal level?
Ask anybody. I don't. When you say, how do you manage? I don't. I'm doing it badly.
You just get through.
Get through.
But tell us then, as I said, you've been doing this for over 50 years now. That's 50. That is a long, long time. How did you get into this?
How did I get into this? Well, I think I started in the fourth standard by saying I want to be a doctor and nothing else. And that was what decided me. I don't think I ever wanted to be anything else. I still don't want to be anything else.
Fascinating. After fourth standard, then.
After fourth standard, well, I just went to BJ, got my degree, MBBS, and then in BJ got my MD. And then I ascended the scale of professorship, etc. And I enjoy teaching students and I
Right,
enjoy seeing
That's
patients.
true. You're a teacher as well, and you
And
have so many students who love being with
many of
you.
the students have done these papers,
Right.
which I have co-authored.
Right,
It's
right,
not
right.
entirely me. It's a team sort of.
But what's also interesting is that, today in the age of specialty and super specialty, you are a general practitioner or general physician,
I'm a general physician.
which is basically the entire body, which is so important.
I would just tell you a bit about, you see, you had asked an interesting question is how does healthcare progress over the 53 years or whatever? Well, we are the luckiest generation, to me and my contemporaries, because
Right.
we've seen it from the time of the general practitioner, where he saw everything.
And
He
she,
was a family member, and like a family member, everything from domestic quarrels
wow.
to advanced cardiac care. So that was
Yeah.
everything. Cardiac care, endoscopies, whatnot, everything.
Yeah.
Now, it is a little bit different, where the general practitioner refers to the MD physician, which is what I am. The general practitioner has everything,
Yeah.
the nebulization, the injections, the immunizations, whatnot, and is there for, as I said, domestic quarrels. The MD medicine has a little more directed approach and will analyze the person's history,
Right.
examination, investigations, and will advise accordingly. And then send to the super
Which is so
specialists.
important that people really
Yes.
should, be aware of. Like I, for example, I'll call you for everything from my stomach
That's fine.
to a muscle pull or to like touch wood, no cardiac problem, but any issue, you'll be the first person I call. And then what you do is exactly what you said. You direct.
I'll direct to people if
required.
required, or I will treat at my level, whatever.
Right, right.
And that suits me very well.
Yeah.
Proper.
And
Hopefully,
it
suits
should-
the patient.
Exactly. I think that's a very
That's you.
important takeaway that people should start with someone like you and then branch into a speciality.
Yes. The patient, people nowadays usually start with an MBBS, but then go on to an MD when the MBBS refers, or they come directly to us. That's
Right,
fine.
right.
I mean, I enjoy doing that.
Okay.
Well, super specialists, of course, pros and cons. It's very nice to have them. Sometimes there is an overkill. Too many stents, sometimes
Right, right.
unindicated surgeries, sometimes,
Yeah, yeah.
or not indicated, or maybe should not have been done, but were done.
Because you're
These are
looking at
the
it
doubts.
just from one
Just
dimension.
from one dimension.
Yeah.
Usually, after going to the super specialist, the person comes back to me and asks, "Is that right?" And I say, "No."
Which is a very important thing to be able to do.
So I didn't,
Right.
deny super specialists. But usually they say, ask your physician.
Yeah.
And then we look at the overall picture. Is the patient fit enough? Is the patient okay? Is he financially stable enough?
Right, right.
Is it going to be worth it? So these are the things that the MD physician would look at.
Right, right.
But we have the advantage of the super specialist on tap.
Of course. So you said the goods and, I mean,
Pros and
yeah.
cons on tap. It's such, and we are all so friendly with each other
Yeah.
in Jahangir,
Yeah.
which is a place to be friendly with each other, and that's how
Right.
it has. We have spanned the whole practice scenario
Right.
over 50 years, from
Lovely. Yeah.
nearly nothing or doing everything to narrowing down.
50 years, as you said. So, I mean, 50 years of wealth of knowledge, research, patient care.
Yes.
What does wellness mean to you in 50 years then?
What does wellness mean to me? I think the Latinos said it the best. It was mens sane in corpore sano. That's Latin. That is a sound mind in a sound body, or a healthy mind in a healthy body.
And I like that you started with mind first.
Yes. Very important. Health does not mean absence of disease. It means that all your non-communicable diseases, all your cancer, diabetes, blood pressure, are well under control. You are in control. You, meaning the patient,
Right.
is in control. And he's following up with his physician regularly to find out that they're still under control. So that is real health. He's managing his daily work with intelligence and with strength, and he's taking his medicines. That's real health.
Right.
And of course, he has something that he loves to do.
Yeah, absolutely.
His career is very important.
Right, right. But then there's so many people that, come through your doors. I can't imagine that number. I don't know whether you have a sense on how many numbers of people that you've treated by now. Do you have do you have a rough idea? Must be upwards of, actually, I wouldn't even care to venture a guess.
But it's usually 20 a day.
20 a day for 50 years. If someone can do the math for us and then tell me later. But given that you've seen so many people and you've healed so many people, and I use the word healed, which is so important.
Necessarily,
Which,
whenever I could.
which is very different from curing, healing, which is something that you've done and so incredibly for so many people. What are the most common things that you see that people come through your doors that you feel can be so avoided by just good practices, good preventive habits?
Very, very important. Actually, the best practices that I would always maintain is lifestyle.
Right.
The lifestyle will be diet, exercise, rest, not excessive, adequate,
Excessive rest.
adequate, 7 hours sleep, one of the best things. And what I call a raison d'etre,
Okay.
a reason for living.
Ah, lovely.
That is the
Can you repeat
major
that?
thing. Raison d'etre, French.
Raison d'etre.
I was bad at French in school. A reason for living.
Yeah.
If you have that, you can live to 90, 80, 100,
Absolutely.
whatever, and you will enjoy yourself and you will be healthy because you've got something to focus on.
Right.
So it's very important of the best practices. The second practice I would earnestly advocate is avoidance of self-medication.
Ah,
I've seen this all the time.
which is becoming worse and worse today with
There are 3 types.
technologies.
Being a teacher, I will have to talk about 3 types. Over-medication, unregulated pill popping,
Antibiotics.
antibiotics, NSAIDs, steroids,
Right.
what have you. People pop them thinking I'll be better.
Yeah.
Stoppage of, point number 2, stoppage of prescribed medication.
Oh, so actually the
My
opposite.
BP is fine, my lipids are fine, my sugar is fine. Why should I continue? Stopped everything. They come to you and say, well, 6 months later, everything is out of gear. And they say, I stopped because I was okay.
Right.
But you aren't now. You see,
Yeah.
that is the problem. And I would include here a lack of understanding of the doctor's prescription. Let me give you an example. Few days ago, tragic example, one patient was prescribed, very, very clearly mentioned, one patient was prescribed methotrexate once a day on Sunday. It was typed out like that. He missed out on Sunday and he took it every day
Oh,
for 10 days.
okay.
He landed in the ICU. I mean, he was. So just the question of not reading your prescription properly.
Oh, yeah,
not
that's
answering. And it was,
that
I
seems
cannot fault the other. They had done it
right,
so clear.
right.
It's not twice a day on Sunday, it's once a day on
Yeah.
Sunday. But he said once a day.
That's something so new, not new, but it sounds so trivial that
People have died because of
not reading the prescription properly. Wow.
methotrexate has killed many people who have taken it daily.
Okay.
I've had a couple of patients who
Right. But I'll come back to the French phrase that you started with. What is your reason for living then?
oh, patients and students
Lovely.
and family, of course.
Yeah,
Family is the basic reason for living.
of course.
But patients and students, which I still teach. It's by-
Absolutely.
yeah.
And you're still doing that at Jahangir Hospital
Jahangir.
now. You've been doing for over 30 years, and you've been seeing
Delight, yes.
and you've been seeing that develop over so many years. And we're now celebrating our 80th
yes.
year of
yes.
Jahangir
I must
Hospital. Of which,
congratulate.
oh, you must be congratulated because you've been a seminal part of most of that period. But you've seen that journey. Where would you like to see that journey go now in the future?
Jahangir is going in the right direction. For one thing, it has not tied up with the corporates. It will remain
bad
like
wolf.
this, a big bad wolf. To remain a family-owned, beautiful hospital with a very nice atmosphere. And I've never thought of leaving for the last 33 years.
Ethical
Nice
healthcare.
atmosphere.
I mean, honestly, it should be
ethical.
everywhere. It should
And there is no, pressure on you to prescribe 10 more 2D
Right,
echoes,
right.
prescribe stress test, prescribe this. No, sorry. You do your own thing. It's up to you. That is what I like best about Jahangir Hospital. Like we all like it, not just me.
Right.
All of us like this. Jahangir Hospital has provided the relevant super specialists, the relevant investigations, and the relevant surgeries which are required in the present day and age. They have not fallen back. Robotics, robotics. If it's a question of angioplasties, rotoblators, what? Everything is provided there.
Move with technology, move with times, everything.
Times. That is so delightful.
But the heart of it still is healing people.
Healing people. Healing people.
Right.
You've got all the appurtenances, may I say.
Yeah. But, you coming back to you, Doc, you've got the aspect of being a superstar doctor in yourself by yourself. You are a superstar teacher, you are a superstar researcher, and on the clinical trials phase. So I can't think of a doctor who actually encompasses all aspects of what, healthcare and wellness should be. So I mean that's just so incredible, and that is so reflective on your own practice, and I'm sure that is something that you probably don't realize, but it happens subconsciously. The importance of all these other aspects. I'm not only just saying this to ring praises on you, which you fully deserve, but I wanted to bring on to the aspect of the importance of research that you place on how that pushes the barrier of technology in terms of medicine, in terms of equipment, in terms of diagnostics. So I just thought if you could just touch upon the importance of that, because otherwise there's a stereotype perhaps that older doctors, they get stuck in their ways, but you are absolutely the opposite of that. You are still looking at new technology, new medicine, researching new aspects of nutrition everywhere. So I just wanted to highlight that and your views on the importance of that for doctors today.
Yes. I am so grateful to the Jahangir family for giving me an opportunity to start two research institutes. One was 1991. We started the basic research into Hirabai Kausji Jahangir Medical Research Institute.
Right.
After your great-grandfather.
Right.
Yes. And since then I've been there. It has provided free health care to hundreds of patients who do not have the wherewithal to pay for it. Now that is one aspect. The second aspect, we are researching on that.
Yeah.
So we have PhDs who do their PhD on these subjects. You know that research cannot cause any economic burden to the patient.
Of course.
The patient will be charged free. Will be free.
Absolutely.
And that is what has been very strictly maintained, not just by me, by my entire team, Dr. Vaman Khadelkar, Dr. Anuradha Khadelkar, all of us, many of them.
As I said, healing is embodied in a lot of people.
Yes, but it's mainly Jahangir has allowed us to do all this free stuff, which I don't think a corporate hospital would like to do.
Right.
I mean, I don't want to say anything, but
Right.
I don't know anybody who would. I mean, there are 800 juvenile diabetics being treated by our institute free of charge. That means
Yeah.
insulin,
For over 15
consultation
years for the same
for
people. Yeah.
so many years and counting. I mean, it used to be 400, 500, 600, 700. It's now 800. Anuradha has thrown up her hand saying enough.
Absolutely, yeah. And she's been where you're sitting, by the way. And we've been talking about
Oh,
the diabetes and the importance of that.
yeah. Now, she's done osteoporosis, endocrinology, oncology, whatnot. We've
Right.
done a number of clinical trials, and they have given really new treatments, brand new treatments, trialed and accepted as safe. And those patients who can't afford the terribly expensive cancer drugs, get them free. Get
Yeah.
them free,
Absolutely.
including the followers of them.
Again, yeah.
Research needs careful, complete documentation of the history of the patient. I always say the best investigation for a patient is a documented clinical record. A documented clinical record of the patient's history is the best investigation. That's what you learn in clinical research. And that is what made me a better physician. I've been trained in this place to keep a very good clinical record
Right.
on a computer of every patient.
Mm.
And that has made me a better clinician.
Which can be difficult for some doctors. Not to name anyone or badmouth doctors, but yeah.
Yeah, it takes time.
Yeah.
But I have a assistant medical Indian
To have you put things into the computer.
who helps me do all the typing in. I mean, it's great. What I'm doing, I enjoy.
Lovely. What are the biggest takeaways that you like to leave us with over your 50 years of personal practice, 30 years at Jahangir Hospital, 80 years of Jahangir Hospital? What are the thoughts that you like to leave us with for people who want to focus on their wellness?
First thing is more power to Jahangir Hospital. More power to this institute, this healthcare, which I'm using a lot.
Which is, I mean, you are the backbone of it. So
I am prescribing a because it's a very tailored approach. You know, a small sum, bigger sum with a more investigation, the biggest sum, platinum, with everything. For those who can do it and for those who need to do it. It's a very nicely tailored, measured approach. So I can prescribe which one I want done.
Right.
And they come back to me with all the reports. So that is one of the nice takeaways. Secondly, is the camaraderie among all the doctors.
yeah,
Politics.
lovely. Yeah.
There's no.
Which is actually, I'm sorry, I don't mean to interrupt you, but that is so important, not just because it's, great camaraderie, but that actually also probably really helps medical outcomes so much better because everyone is a team.
Everyone is a team. You talk to each other in the lift, in the corridors, anywhere.
Yeah, no doctor ego.
No doctor ego at all.
Yeah.
Everybody loves everyone else. So that's
Yeah.
wish.
Sorry to interrupt you. We were going on.
That is second great
camaraderie.
takeaway.
Right,
Thirdly, the complete cooperation I receive from the team,
right.
from everyone, right? From sweepers right up to the top, right up to the top of the administration covers.
Right.
We receive the best cooperation. I wouldn't go anywhere else.
Lovely. Any last words you'd like to leave us with in terms of wellness for people?
Then this for people.
Given the wealth of experience that you've had, is probably more than anyone else has spoken to us this show. So,
Just remember, mens sane in corpore sano.
okay.
A healthy mind and a healthy body. That's
Healthy mind and healthy body.
healthy mind and a healthy body. Some Latin lesson, I don't know who, said this about a century ago.
Lovely.
Still holds true.
Yeah, absolutely. A century ago. So and Jahangir Hospital is 80 years, so we're not
80 years
far
of
behind. So we've been following
Yes,
it,
we've been following it.
for a long time. Healthy mind and healthy body.
Yeah.
Thank you so much for everything that you've done, Doc. It's incredible, and we hope to have you for many. I know you will be there for many years to come. Absolutely, we're not letting you go anywhere. So,
No, there is one way, and that is upwards. But anyway,
you'll always be present. That is for sure. Thank you so much, Doc, for being here. It's been long pending, but I'm so happy that you're finally here.
I'm finally here. Once again, thank you for everything.
Thank you so much. Thank you all. And before you leave, do not forget to hit the like and subscribe buttons here at the bottom. Please leave your comments for any feedback that you might have, any topics you'd like us to cover, and we'd be happy to take that forward. And lastly, have a very good day, and we will see you next week. Thank you.